My name is Rick Farrant. I'm the family patient representative. Thank you very much. My teammates told me to look at you like you're all sitting in your underwear. I'll give you a report later. I'm here to tell you, actually, on my way to this report, I had a little medical emergency and I lost my notes. So we're going to wing this. I'm here to tell you what it's like to be a patient coming into emergency with a medical problem and also having a background with mental illness. Present state, when I present that emergency, they found them. Thank you. Present state, when I present that emergency, I'm asked a couple of questions when I get to triage. Do you receive home care? Why are you here? And what's your problem? And then I'm brought into a room. Nurses come in, ask how I am. I can give clues as to what my medical problem is. I can also give clues to how I'm feeling. That is never picked up on. They're more interested in what my medical problem is at the time. In the future state, we want not just doing these. But when I come to hospital, I hate coming here because I am really fed up with coming here. I'm fed up with everything that has to happen to me. Anywhere from needles to dialysis to all kinds of stuff. Intravenous's, surgeries. I'm just tired of it. But that never gets addressed. But when I present that emergency, I tell them what my problem is, and during the mock-up, I fill up with fluids quickly and I can't breathe. And that's all that ever gets addressed. In the future state, they're going to ask me at triage, how are you coping with this? They're opening the door for me to tell you something. They're giving me a chance to say, I'm having trouble. When they get me into a room and start my medical treatment, they can come in and ask me some further questions and do a little further assessment while they're giving me my medical treatment. The medical side comes first, and I'm given an opportunity to breathe easier. And they'll ask me, how am I coping? How am I feeling? Am I receiving mental health care? Am I on medications? It opens all kinds of doors for me. It's never been offered to me before. I've never been able to tell you how I feel when I come in here. I've reached a point, and while we were doing this mock-up, I sat in the mock-up like this, totally defiant to the whole thing, although I volunteered to do it. When they got to that question and asked me, how are you coping? It was, they opened a brand new door, and I went from this to this. And I was able to tell them how I feel, how I want to give up, how I'm fed up with everything, how I want it to end, just end everything for me. And they offered me an opportunity to come into hospital and get full treatment, not just for my medical problem, for my coping skills, so that I could deal with the situations I have to deal with, because I have no idea how to deal with them. I don't know how to handle what I've got. I've been trying to do it for the last year, and it was driving me crazy. Now I have an opportunity. If this program never gets off the ground, it's already worked, because somebody just saved my life this week. I was that close to the edge. I now have an opportunity to come back here and get the help I need. I didn't have that on Monday, but I have it today. And this is a program that's already paid for itself as far as I'm concerned. Thank you.